Yeah, Dr. Hinckley really joining us on the perfect day because it's so sunny outside and sunny tomorrow. We do need to talk about skin cancer and prevention. And this is Dr. Michael Hinckley. He's from the Granger Medical Clinic located in West Valley. And this happens, I was just talking to you before, so many of my friends dealing with this right now, and here we are headed into spring and summer. What do we need to know about skin cancer and protecting ourselves?
Well, the key to protection is, or prevention, of course, is protection. Sunscreen, we all know about. Don't need to harbor on that point a lot. Hats, we don't talk about protective clothing as much as we probably should. Wide brim hats, particularly for men whose ears are exposed to the sun. But hats and sunscreen, trying to avoid the sun between 10 and 4 is ideal, but if you have to be out, make sure you have those protective measures.
Dr. Hinckley, do you wear sunscreen every day?
If I'm going to be outside for more than just a few minutes, I try to put sunscreen on.
And so many of us right now just soaking it in, and we have to remember that those rays can be harmful.
Exactly, yes. And again, I tell people they don't need to hide in their basements. They should go out and enjoy life and do what they need to do, but just make sure you're protecting yourself.
Okay, now we talk so much about melanoma. That's that big word that I think we're all familiar with. But what about those pre-skin cancers that we're hearing more and more about?
And those are much more common. Melanoma we tend to focus on because it is very dangerous and can be fatal in some cases, but there are far more cases of these pre-cancers or milder skin cancers. And they tend to be more subtle. Melanomas in general are very dark, larger than a pencil eraser, tend to be quite black in cases. But these other more subtle pre-cancers and cancers are more pink. Sometimes just a little scaly spot on your nose or cheek or ear that won't go away. Or the other types of skin cancers, basal or squamous.
Let's talk about those.
Yeah.
First, the basal.
Yeah, the basal, they tend to sometimes just be a shiny little bump, skin-colored, pink, purple. They may start to bleed over time, and here's an example that's a little more obvious, but sometimes they're much more subtle, where some people will say to me, boy, I just thought this was a pimple for the past 6 months that wouldn't go away, and it started to bleed a little bit. And they don't always look very obvious, but if you have a spot that won't heal, a little pink bump that looks different than others, that's a key.
I'm so glad you're showing pictures because I'm with you. So many of us say, I guess that's fine. Do I go get that checked? Do I not?
Right.
All right, what's the second type?
So the second most common type is called squamous cell cancer. And they tend to be usually pinkish also, and sometimes they get a little bit of a scaly, flaky look to them as well. Again, they don't look so dangerous like the big black melanomas do, but if you have a sore that doesn't look quite right, it's pink, it's flaky, sometimes these may bleed or get a little tender, particularly on sun-exposed areas. It's important to get those checked.
Dr. Hinckley, I called those pre-skin cancers, but they are still cancers.
Well, those are cancers, and you do have pre-cancers, and they tend to be very subtle. Sometimes you almost can't see those. You just feel a little rough spot, particularly on the sun-exposed areas again, and that eventually can turn into one of these other types of skin cancer.
Do those turn into melanoma?
Those don't. The little rough, scaly ones typically turn into most commonly squamous cell or occasionally basal cell cancers.
Okay. Is this a melanoma, or is this one of those
No, this is one of those other, what we call non-melanoma, basal squamous. So the basal and squamous have more of a pinkish look. The melanomas are more black.
To put this into perspective for everyone, every single year in our country, there are more skin cancers diagnosed than prostate, breast cancer, all of those put together.
Yes.
Really?
Yes, and so that's why there is an epidemic of skin cancer. Over the past, we've talked a lot about these internal organ cancers that can be so dangerous, but the skin cancers, fortunately, are not usually deadly, but they can be disfiguring, and some do become fatal, and that's where detection and then treatment becomes so important.
How often should you get your skin checked?
I like people to be checking their own skin or with help of someone else twice a year on their own, and then if they see something suspicious, to go in and see their doctor.
And Dr. Hinckley says be aggressive. Don't just take a peek. Take a good look at your skin. Get that checked. The Granger Medical Clinic is a great place to do that, everybody. Go to our website, and we will link you to all of their information. They are located in West Valley, and that's where you can find Dr. Hinckley and their staff there. goodforutah.com/midday for more information. Thank you so much.
Thank you, Necia.
Good to see you today. We're going to grab that sunscreen. Brian and Em, back over to you.
Thank you very much.